think we're good.
Okay. So today we're talking about hormones in harmony and understanding how to manage hormones through a functional medicine perspective. My name's Lea. I'm a physician assistant here at Ashtoria Aesthetics Wellness. Okay, so today we're going to talk about what is functional wellness and functional medicine, why hormones matter, not only for hormonal balance, but for other systems in our body and our overall health, and then how to optimize hormones for better health. Okay, so a little about me. The last few times I forgot to say about me and who I am. So I'm a certified PA. I believe in holistic mind, body, spirit medicine, and my goal is to practice that type of medicine and helping others discover their inner healer, because I believe that's what truly heals, as well as finding and maintaining genuine social connection, because I think that's an important piece of medicine that is not addressed enough. So I very much believe in a holistic, integrative approach to health, and addressing mental, physical, and spiritual health all at the same time. Okay, so I did my training here for PA studies at CBU. I'm a certified life coach. I am in training for functional medicine. I completed one of their courses. They're a 3-month, most intense course. The certification takes about 2 years to complete, so I'm working through that. Also have an added certification in psychiatry, so I'm very much about brain and mental health. And I've been working here at Ashtoria since 2024, August of 2024. Okay, so the difference between functional wellness or functional medicine, the really two are interchangeable, and conventional medicine. So in functional medicine, we're health oriented. Conventional medicine, disease oriented. We're treating diseases and symptoms. Functional medicine, we're patient centered. We focus on biochemical individuality, very holistic in the approach, cost effective, and we're actually looking at the deep root causes of illness. We practice and highlight preventative medicine versus reactive medicine, and very high touch and using the technologies that we have available and that are continuously being invented. So back to conventional medicine, again, disease focused, doctor centered. Everyone is treated the same. You follow the same protocol for each person. You have specialties. I can't remember how many specialties there are now, but it's well over like 100, different specialties in medicine. It's crazy. It's all about diagnosing illnesses, DSM-5, diagnostic codes, and naming them versus looking at what the actual cause is and addressing that cause. They focus on early detection of disease, and they call that preventative medicine, when still it's reactive medicine. They're not doing as much as we need to be doing to help prevent illnesses from happening. And they're high tech, they use technology, but they're not very high touch. You get maybe 5-10 minutes with the doctor until he has to go see his next patient. So I have up here on the table a lot of what I base this presentation on as far as hormones. This book called Normal Isn't Optimal. If you go to conventional medicine doctor, they may look at your labs and hormones, and depending on your age, if you are postmenopausal, they're like, oh, it's normal for your range. That's normal for you. He really dives deeply into just because it's normal for that age range does not mean that's how it has to be. And we can really start looking and feeling like we're in our 20s and 30s when we're in our 60s and 70s if we have the right hormone levels. So normal lab ranges do not equal optimal health. It's based on population averages and not each individual needs. And his approach and our approach here is that symptoms matter more than the numbers matter. The hormones are behind the scenes conductors of absolutely everything that goes on in our body, from our mood to our metabolism to sleep, sexual function, even blood sugar management. A lot of people that are experiencing fatigue and weight gain and brain fog or low libido, it's like, your labs are normal, sorry, it's fine, we don't need to do anything. But it's more about what is ideal and not what is normal, and what is optimal. And another thing that he talks about is we're not trying to superdose people and overdose people for hormones. We're talking about restoring it to where you feel at your best, you know, your 20s and your 30s, and you can feel that way again. So. Yeah. It's not going. I'm frozen. There we go. Okay, got it. Okay, so what are hormones? They are chemical messengers in our body. They control metabolism, mood, energy, sleep, and the key systems, body systems that are included in this are your endocrine system, your nervous system, and your immune system. So we have a couple different glands in our body that produce hormones. We have the pituitary gland in our brain, the thyroid gland, and the adrenal glands, which are kind of all over. We have the pancreas and the ovaries, that's female, and then testes in males. So some key hormones are growth hormone, which stimulate growth and development, cortisol, which regulates metabolism and stress response, insulin, which helps to lower blood glucose levels, melatonin, that controls the sleep-wake cycles, estrogen that regulates the menstrual cycle, and then testosterone, which controls puberty and reproduction. Of course, that's not all the hormones, just examples of some of them. So, you know, hormones really, and what the author of that book says, are the key to unlocking energy, clarity, and vitality, and resilience at any age. So, you know, they regulate nearly every biological process in our body, and they help facilitate energy production, metabolism, mood regulation and cognitive function, reproductive health and sexual function, sleep-wake cycles, stress adaptation. So when our hormones are in balance, we actually feel focused and steady, energetic, but if even one part falls out of sync, the ripple effects can show up in subtle and not so subtle ways. So again, some signs of hormonal imbalance include fatigue, weight gain or resistance, mood swings, anxiety, depression, it's very sensitive, poor sleep, low libido, and brain fog. Some other signs: irregular periods, persistent acne, weight gain, hair thinning, that's in women, and in men, pretty much the same. Erectile dysfunctions in there, loss of muscle mass, that can be in women as well. Hair loss, low mood, fatigue. And you don't have to live with these symptoms, is the point. No, you know, some people say that we do, it's just part of getting old. So why conventional medicine falls short? You know, again, they focus on disease and not prevention, treating the symptoms and not root causes, and you're normal, you're just getting older. So the functional perspective for hormones, you know, we're seeking optimal function and not just absence of disease, looking at the root causes and focusing on whole body systems, not just one particular set of issues. So, you know, we're really trying to shift away from disease and go into root cause resolution. So that also includes understanding how environmental factors influence your hormones, your lifestyle, how much stress that you're carrying, your stress load, genetics, and your environment. We get bombarded by so much, you know, xenoestrogens, you know, which are like fake hormones, or, you know, he even, and I don't go into in this presentation a lot, but he talks about how, you know, all these studies, and I may touch on it a little later, but all the studies that they've done to say that hormonal treatment is, it's, you know, bad for your heart, or can cause strokes or blood clots, and it's not safe. That's all fake estrogen. That's the horse that they get from horse urine estrogen. But bioidentical hormones that they make that are identical to the estrogens in our body, which horse urine estrogen is not identical to our, you know, it's similar enough, but it doesn't fit our receptors. You know, the hormones actually, they go onto the cell, onto the receptor site, and they have a perfect fit. Well, if it's not a perfect fit, it's just kind of like you're jamming something into a place that it doesn't fit, right? But when you introduce something that is just like our hormone, then it fits perfectly, and you don't have all those side effects that the fake hormones do. Yeah, very interesting.
And that's the plant-based, correct?
Yes. Yeah, from plants, or I think sometimes they will, it's like genetically made, but it still is Yeah.
Bioidentical.
I know, I like the thought of it being from plants. But I do think that is a distinction, though. It's like, is this plant-based or is this something else? Yeah.
Or animal.
Mm-hmm. Okay. Yep, kind of what we just said. You know, in conventional medicine too, they'll test some hormone levels, but it's pretty limited. We really focus on in functional medicine looking at the hormones across the board because you really understand the full picture of what's going on. You know, it's hard to just get a testosterone level checked, for example, or even an estradiol level or progesterone level just in isolation and think that you really know exactly what is going on. So, you know, we're looking at any particular root causes of hormone imbalances, and then individualizing the treatment for each person depending on what we see. And lifestyle changes are key. Like, we can do all the treatment in the world, but the whole point of functional medicine is, like, you know, empowering people to be their own healer. And to be your own healer, you have to take care of yourself and do those things and make those changes that are gonna cause improvement in your health. And it's not always the easiest thing to do because, you know, especially in America, we're kind of lazy in a way. I hate to say that word, but like, that's just kind of how it has been, and it's difficult to change out of that mindset. So some key hormones that we would look at, these are some of them. Of course, your thyroid hormones, and that's another one that conventional medicine will often only look at your TSH level, your thyroid stimulating hormone, but that's not going to tell you very much at all. You know, it could be normal, but what if one of your other very important thyroid hormones are out of whack and you're having symptoms? You won't know. So you want to do a full thyroid panel, cortisol, which is testing stress response and issues with that system in your body, which a lot of us have. Insulin, which looks at blood sugar balance, estrogen, progesterone, and testosterone, of course, are the sex hormones. DHEA is like a precursor to the sex hormones, which is also a very important one to look at. Melatonin, and then LH and FSH, which is luteinizing hormone and follicle stimulating hormone, which are important to check in men and women for various reasons, for different reasons. So, again, you know, the interconnections of hormones and how they work in our body, they don't work in isolation. Stress impacts thyroid hormones, sex hormones, and I don't know why I didn't put cortisol in there, that is the stress hormone. But, you know, stress impacts these systems in our body and it can cause issues. And then blood sugar impacts testosterone and estrogen production too. So if you are having blood sugar management issues or any metabolic issues, that's going to affect your hormone system as well. So it's like you got to look at all the things and address them. So some other things that can disrupt hormone balance. We've got gut issues, if you're having a lot of gut issues, and hyperpermeability, which means the lining of your gut is not, it's permeable. There's too much going in and out there that should not be. Yeah, sorry, this is like a medical slide, but a lot of fat around your abdominal area, poor sleep, acute and chronic stress, inflammation, infection, trauma, having toxins, nutritional insufficiencies, which you were talking about earlier, genetics, insulin imbalances, poor diet, alcohol, smoking, other substance use, food allergies, sensitivities, and intolerance. So all of these things can impact your hormones, and if we're not looking at all of these and you're still having issues, that's something important to really dive into and address.
Sensitivity is good.
Yeah.
I did that. I had a lot of surprises.
You did?
Mm-hmm.
I was fun.
So-
Yeah, stool sample.
Yeah, that one's really important too.
Yeah.
So a little acronym to keep in mind to remember: statins. Stains, not statins. Stains.
That's bad.
Not statins. We're like, no, yeah, statins are bad. Stains. So stressors, toxins, antigens, allergens, adverse food reactions, inflammation, nutrition, and sleep. So the core message in Normal is an Optimal book. Is optimal levels of hormones, you're going to get some symptom relief. Use bioidentical hormones, not any other fake hormones. And treat based on clinical symptoms, not just what the labs look like. So even if the labs are normal and your provider is telling you that your labs are normal, but you're still having symptoms and they're not listening, then you need to find someone else that actually is listening, because we're all very different and individualized. We can't just be compared to a population average, right?
And I think, like we were talking about before too, if your doctor, instead of optimizing your hormones, has slapped you on an antidepressant, that's a red flag.
Yeah. Oh, absolutely. Absolutely. Yeah. Because that's a big, that was one of the symptoms of hormonal imbalance, right? Is mood swings or mood changes. And depression is very common, in hormonal imbalance. So, yeah, that's not the answer to start on an antidepressant. So, we talked about this really already, but what is bioidentical hormones? Again, it's the hormones that are exactly like what we have in our body. It's a lot safer, it's natural, and it's customizable. I really prefer to use compounding pharmacies to make the bioidentical hormones, but if you have insurance, which a lot of us do, and you want to utilize the benefits of that, estradiol, tablet is great. You can get that at Walgreens, and insurance should usually cover it. I think probably the estrogen, where you do like the mixes of estrogen, which I don't think are absolutely necessary in most cases. Estradiol is by far the most beneficial estrogen in our body. But I like compounding pharmacies because they can do the creams or the troches in different forms, because not everybody can take oral. That was another thing that was mentioned earlier. He talks about creams are okay, but really oral's the best. Oral is the best because it's actually going to give you that protection. The studies that were saying that it was, could cause heart attacks or strokes and was hard on your cardiovascular system were, again, the fake hormones. But what they're actually finding when they're studying bioidentical hormone replacement is actually protective of your cardiovascular system. It's protective against strokes. It's very protective. Estrogen is very highly protective. You only get that protection though when you take it orally. You don't get as much protection when you do like transdermal creams, which is interesting. Yeah. So it's like it might control. It may or may not control your symptoms, right? But you're not getting that systemic benefit from what estrogen can do. Okay, so so comprehensive hormone panels are important. Blood, saliva, a mix of the two. Another thing that functional medicine does versus conventional is that we not only look at normal ranges, we look at optimal ranges. Well, yeah, you may be in the normal range, but you're at the very high end of the normal range. So, you may be having symptoms, but you're in the normal range, but you're not in the optimal range. So we're really gonna work to get you there, because that's how you're gonna feel your best. And then, it's very important to retest and track symptoms when you're on treatment, because we have to know what's working, how it's affecting you, and make changes as needed. Other things that are important as far as lab testing to look at is, of course, blood glucose, insulin markers, micronutrient testing, so vitamin D, magnesium, B6, B12, all really important. And then gut analysis, like a GI map or something like that, especially if you're having some gut issues, really important to look at. And also liver function tests. So a lot of things can affect your hormones. And heavy metals as well, mold, right? If you have these things in your system that need to be detoxed, then you're not gonna feel your best. And they're taking up space where the hormones can't really do work. Okay, and then lifestyle factors, of course, are important. Nutrition, sleep hygiene, getting enough sleep, knowing what works to manage your stress so you can keep that very low. Exercise, of course, is key. And then looking out for any potential environmental toxins that may be impacting you. If you work in certain industries or live in an area where there's toxins, then that could certainly be impacting your hormones. Okay, so the functional approach to treatment, we're going to support any detox that needs to happen. Of course, testing for your hormones, supporting your thyroid function and your adrenal function, and only using bioidentical hormones for treatment. Providing nutritional support as well, and any coaching, that is needed to go along with that to make changes in your sleep, how you approach sleep, your stress, movement, and exercise. And then also targeted supplements for like adrenal and thyroid health as well. As far as diet, you really just want to emphasize whole, unprocessed foods that are high in fiber, healthy fats, high quality protein, and then lower those high inflammatory foods, sugar, alcohol, dairy, gluten, if you're sensitive to that. And then stress, mindfulness practices, so meditation, yoga, doing deep breathing practices are all great. And then just making sure you get a good 7 to 9 hours of sleep per night, turn the screens off an hour or two before bed. And then, as far as physical activity and exercise, you really want that resistance training, especially in women. That helps support hormone production as well. So, and I'm telling myself that I don't do enough strength training. I like my yoga and my Pilates and all that, but not necessarily weight resistance. But it is really important for hormone production, and we need to do more of that. And then as far as disruptors of your endocrine system and your hormonal production, plastics, pesticides, cosmetics that have a lot of, the parabens in them. And you add all these different little things that you're doing in your life together, it's just like the perfect storm. It's like we don't have to be perfect. We're not all going to be perfect and do all these things. But if you want to be healthy and improve your hormone balance and just your health overall, pick a couple things that you can address, and then start small, and then just continue to make changes and improve. And there's no perfection, but just do the best you can as far as lifestyle goes. Yeah, high quality vitamins and minerals too. That's another thing. It's so easy to, and I've been there where I'm trying to get my supplements in, but I'm not about to spend a lot of money on supplements. I'm just getting whatever brand. It's a big difference from what you're getting as far as quality goes. So if you're gonna spend the money on it, you might as well spend the money on a good quality supplement. And then another thing that I'm finding in a lot of my clients and just people in general, there's all the information out there that you could figure out a lot of things on your own, and then they'll do their own research on supplements and buying this and that and the other, and you don't know really what's interacting with what. And maybe you could actually be taking a lot less things if you have somebody else to look at it with you, to really see you don't need that, let's simplify this, right?
Like the micronutrient test.
Right. Yeah, because I think a good high quality multivitamin is a good thing, depending on the person too, but not everybody needs all of that, and really you need more targeted supplementation, so yeah, just another reason why we all need each other. And that's why a functional medicine doctor is a good, ally to have, especially in your health. And then eating organic if possible. I wish I would have looked this up before I just thought of this. I was watching a podcast, and he was talking about how the process to go through to get certified organic status is insane, a very long process. So a lot of the not organic produce that we have are actually organic. It just can't have the label of organic.
It takes at least 7 years, I think, to get that organic status of not putting any pesticides on. And
that's which is crazy. But he was talking about there's something that you can do with apple cider vinegar. I wonder if either one of us that with any non-organic produce, you can do something with apple cider vinegar, and essentially it makes it organic.
It removes.
It removes
the surface level
exactly.
Interesting.
Yeah. I don't know.
I think I have heard of people washing their produce in apple cider vinegar, but
really.
I don't think I knew it was for that reason.
Yeah, and that's better than nothing,
Yeah,
Sure.
apple cider vinegar and baking soda helps bubble it off.
So yeah, that's an option if you can't afford or find organic stuff. Okay, so next steps, if we need to look at hormones, you gotta get tested. Can schedule a consultation with us to see, if our program would be helpful for you, and then if you move forward, we really will come up with a personalized wellness plan, which I actually spend a lot of time creating. I create a blueprint based on all the information that I have. And it's actually really fun and interesting, and I've found some things that others haven't found just because I'm really taking that time. So yeah, the investment is worth it in my opinion. Anyway.
You can talk about how much time you spend too, like it's 90 minutes.
Oh, that's right. Yeah.
Like those first 2 appointments are an hour and a half.
Right.
Each.
Yeah, exactly. Yeah, two 1 hour and a half appointments on our first meetings. So I get to know a lot, and it really helps me help you. Yeah. So I have some handouts up there. If you want to grab either of those, just like little quick tips about hormones.
Are they different or
They are different. Yeah. Oh, I forgot to take the. Yep. And then that's a book that really is good for anybody to read. It's good for me.
Well, it's only one book.
Yeah, that's my copy. But if you wanted to take a picture of the cover,
Okay.
Yeah.
I was about to get the book.
yeah, it's definitely readable by anyone that's interested in optimizing hormones. So
Yeah, that looks like
It's
a
good
good one.
information for you to know, and some of the things that he's talking about, they may resonate with you and how you're feeling.
So, any questions? Anyone?
I have a question. So,
Okay.
like, my test showed that my estrogen, I think it was specifically estradiol, is that right? That it was high. My progesterone was low, so we're supplementing with progesterone. But how would I lower my estrogen? Is it something that just naturally balances out when because my testosterone was good, but
It can.
Yeah.
That's why it'll be interesting once you've been supplementing with progesterone for a while to
Yeah.
see, because a lot of times it can bring it back into balance.
Mhm.
For you, I would also say look out for those xenoestrogens, those those endocrine disruptors. Also, too, it could be something that, and I don't think we did this test on you, the organic acid
I
test.
don't think
It
so.
could be the way that you're not able to like detox the estrogen or like process.
Okay,
the
so it just kind of
estrogen.
sticks around.
Yeah, so
Yeah.
it sticks around, but it's not helpful.
Okay.
You know what I mean?
Yeah, because
Yeah.
like I was thinking about it, and I don't eat a lot of phytoestrogens, like plant-based estrogens. So, and I've spent the last 15 years or so working to remove like parabens and all kinds of toxins from my skincare and body care, but I'm sure there's something that I'm missing, or it could just be environmental. But yeah, I'm just trying to think like what else can I change to help lower that, so I'm not just waiting and hoping that progesterone balances it out for me. Yeah.
Did you do the food sensitivity test? Nothing major came up?
Yeah, I had. Well, nothing was in like the red. They were all like mild sensitivities, but it was like dairy, specifically like cow's milk and mozzarella cheese, and eggs, and pineapple.
Pineapple was mine too.
Yeah, so I've stopped putting pineapple in my
That's my
smoothies.
daughter, so I will have pineapple.
Two daughters?
Mhm.
Hi.
Yeah.
My older daughter.
So you must have been Ashley.
Yes, I'm Ashley. Yes.
You said your name. in the place.
Yes.
Yes.
Yeah. Well, let me look into more, because I think there's probably some other things that you can do to help lower that estrogen. But we probably need to, after you've been on it for a month or two,
Okay.
check the hormone levels.
Yeah, because I
And see what
just,
it's looking
you're 2 weeks on and 2 weeks off. So I just finished my first 2 weeks, and I just had my period like at the end of this last week. So I'm finishing that now, and so I think in another week, like not this upcoming Tuesday, but the week after, I'll start the cream again, for progesterone.
Okay.
And so yeah, I'm curious what like when my cycle comes in May, what that looks like, if it's still consistent and that kind of stuff.
Yeah.
Or if I notice any difference in like my energy and fatigue and that kind of thing.
Right.
Yeah.
Yeah, that would be interesting.
Yeah.
Okay.
So what you're saying, all those hormones, replacement is better to take by mouth?
It
Or,
provides,
or only estrogen?
this is estrogen specifically. I'm not a big fan of the pellets either.
It's something new, and I was like, okay, if they put it in and something is not working, I cannot take it out.
Yeah.
I just like, I'm not gonna do
Yeah.
I kind of like feel.
Yeah.
It's a little odd.
It's odd.
I'm pretty certain. I haven't finished the entire book. I haven't looked at what he said about testosterone because that's going to be different. But I would say progesterone as well and estradiol oral really provides the most benefit. But most specifically estrogen as far as the systemic benefit. Other forms like the creams, it may help your symptoms, may help, may not. But it may not provide that protection. Like it also protects the brain too. They're looking at it to prevent, and the bones, right? Exactly. So, which is when women go into menopause, our bones get really brittle.
Well, the reason why I went by cream because my stomach is sensitive. You know, I have like GI problems, and most of my problems comes from that as well. And and then that's why I thought, well, I get less stress on my this, so I just go this, cream, and I don't know how, the pills will be affecting my stuff. I mean, are they aggressive or?
No, not
for the
anymore.
stomach?
I mean, if you said that you take an antidepressant,
Well,
you're taking that orally.
I know.
But you know what I mean.
I just.
Well, and I think too, something for you to look at if you're having all these gut issues, that could be affecting your hormone levels.
And I
as
have
well.
these like anxiety attacks, and I constantly, like in the morning, they say the cortisol level is very high, and I'm waking up. I have such anxiety. I just like I need to take something because I could not, function. It's crazy.
But a lot of that can be gut.
Yes.
From your gut,
and
too.
I know
Because
something.
My son Stevie was dealing with that. His gut's getting much better too. He's had to cut a lot of things out.
And I don't
But
really-
he was having a lot of gut issues and anxiety
Mhm.
and panic attacks and
that's
and that's kind of the problem with conventional medicine too. You gotta go to a GI doctor who's only concerned with your gut. You gotta go to a different doctor who's only concerned with your brain. They're all connected. They're all so connected. So if we can get the gut balanced, sometimes that's also like Lea said, a help for the hormones and when the hormones are right, that anxiety and stress can go away too.
Right.
It's all connected. It's
Right.
not just
Well, and with functional medicine, we most of the time we say start with the gut first.
Oh,
A lot of the times you got to
Yes.
start. You have to address your gut issues first
Yeah.
before anything else can really get back into balance. Yeah. So like a stool test to look, a micronutrient I think too, and food allergy sensitivity would be important to look at for
what
you.
did I have? What did I have show up in my stool? Which we all have, but mine was a little high.
Is it a certain bacteria? Or
Yeah.
Oh,
Trying to tip my tongue.
H. pylori.
Yes.
Yeah.
Are you had H. pylori?
Mm-hmm. And we all will have that in our system a little bit, like yeast. We all have yeast.
Mhm.
But if it's getting too high because of how we're eating or lifestyle or whatever, I had to really focus on lowering my sugar and processed carbs because I love bread. I love all that stuff. So I had to focus on tapping a lot of that down. Yeah. Because I'm surprised like yeast was this high too. I did it because I had been eating too much sugar before we took that test.
I
And
know.
it's
It's gotten better, but
My sugar, sugar's in mine.
But like and with food sensitivities, like in the red was eggs. I had 4 different nuts that were in the red. Gluten. And it's funny because that test differentiates between, it said both egg whites and egg yolks. I was highly sensitive to. And then also with almonds, it's specified that I'm allergic to almonds but not almond milk. So to me that tells me that it's probably the skin, the lectin.
They say the skin is, you have to kind of peel the skin and it just.
Yeah, and even with walnuts, I've noticed, like when I was out at Dragon Herbs in LA, they sell skinned walnuts for the same reason. Because walnuts are so good for our brain, but some people have sensitivities to that skin.
Huh.
Good to know.
Yeah, it is good.
So yeah, there's just so many little things that we don't normally get tested for that, well, those little tweaks
can really make a difference. You never know what's going to be kind of the key
Yeah.
for you. Not that there's ever one answer, but sometimes you have to address this thing first for everything else. So like it's going to fall into balance a lot easier.
And we're all so different, and that's what functional medicine is. We're all so different. Like I could be eating things that I think are health foods, but I'm sensitive to them.
Yeah, exactly. That's what I'm doing. I'm trying organic and everything, but it's like something is wrong. I'm doing, although I try to eat healthy, exercise, and everything, but it
It's a lot of detective work.
It's a lot. It is. It's kind of fun.
Yeah.
It is fun.
Yes. If you're passionate about it, it's fun figuring those things out for people.
Yeah. And when you have the time to do it, you know, I think doctors, most doctors are well-meaning, but then when you get into the system of insurance and the typical healthcare system, it's like you don't have time to be the detective.
You have to see a patient every 10-15 minutes.
Right.
It's not
yeah,
enough
he
time
said
to
like
address
it's 15
anything.
minutes and what you can do in 15 minutes. I have a friend, he's a doctor, and well, he was surgeon and now he's just practicing, you know, like, and he said, what you can do in 15 minutes, you cannot give them. He said they go milder on me because it's like nurses clinic, but they have to have doctor on the top, so he is a doctor, and so he said they go mild on me, they give me like 30 minutes, but still, you know, it just
Wow.
hard.
It is. Well, any other questions?
Yeah, that was a good overall explanation for hormones. Yeah.
Thanks. Good.
I think that will be good for us to put on. You can start that. But I think that will be good for us to start filming these because it's just little snapshots of information we can.
Well, we can